This is a presentation of a inferior glide of the right radius. And it can be subtle at times, but what you do is you look at proximal supination and you'll see that soft tissue event there. And on the right side, when I take her into supination, about now we stop seeing movement here, and I know you can't see that from the camera. It's going to be too subtle even if I move the camera. But there's also a rather firm end feel if I try to passively take her further into supination, whereas this one I supinate it with the elbow straight as full as it can, and it goes easily 20 degrees extra, and it has a soft end feel. This one with the elbow fully extended, I take it into supination and we're at -10, and I can't force it any more than that. Okay. Another way that I like to evaluate it is to feel the sulcus at the base of the radius, okay, and compare sides. You can find the styloid very easily and fall into that little sulcus and then compare sides. And it's usually not subtle, but this sulcus is deeper for the simple fact that this radial head has shifted down a small amount. It does make the annular ligament tighter, and sometimes you can feel a significant increase in tone overlying that radial head and just below it. In this example, it's subtle. I don't know why. Could be the shape of her radial head is different than normative anatomy, but we have enough science here to tell us that this radius got pulled inferiorly. I'm going to test your strength, so we'll keep you at 90 degrees. Your elbow's bent. Don't let me rotate you this way, okay? At the count of 3, 1, 2, 3. Okay? Do the same thing here. At the count of 3, don't let me rotate it. 1, 2, 3. Okay? So it's easy to break that. And it's not uncommon to see this in an outpatient population. Just a guess, at least 15% of that population presents with it. Why? Well, they carry groceries and they carry heavy things, mostly on the right arm. If they get hit by another vehicle and the steering wheel jerks very abruptly, our tendency is to oppose that, to try to control it. And sometimes you can stabilize proximally, but the force of the steering wheel pulls ultimately on that radius. So the first joint that can go will go in that direction. Anyway, we could speculate, on and on and on, but it is a pattern we see in the clinic. You can see that how it impacts her strength on that forearm, and ultimately when she's doing some activity, she's going to have to compensate with other parts of her body, shoulder girdle, upper back, in order to gain motion that she has normally on the left side. So we're going to treat it and we'll come back and show the benefit, okay?